Hi, Randy Brown from Sunrise Medical Group to talk to you today about colon cancer, cancer screening really. We look for colon cancer because we know that if we find those cancers early, they're highly treatable. If we find a precancerous or small cancer in your colon, we find it early, we can treat it either locally by colonoscopy or sometimes by a small excisional surgery, and you don't have to die from colon cancer. But how do we find it? Well, we got to look. So we have some screening tests. Now let's talk about them. First of all, you don't know you have colon cancer until you have advanced disease. So it is not a good idea to wait until you have changes in your stool or weight loss or pain before you come see us to check for colon cancer. We recommend you start about age 50. There are a whole bunch of ways to get screened, some better than others, some more invasive than others. So we get to decide when you come talk to us, what's the best plan? So the first thing is we can look for blood in your stool. We have some tests where we give you a little kit to take home. You gather up a little stool, put it on a card, send it to us. We put some special dyes on it to see if there's blood in it. If there's blood in your stool, well, we might want to chase that down a little further. Many times there's blood in your stool because you had a steak the night before, but sometimes there's blood in your stool because you have stomach ulcer or an early colon cancer. So it's important for us to do some screening, and the stool guaiac, or looking for blood in your stool, is a great test. There are some newer tests for that, and you can talk to your provider about those. They seem to be a little bit more accurate in terms of looking for the DNA-like changes associated with it. They're not uniformly covered by insurance plans. There are things called virtual colonoscopy, where you can get a CAT scan that looks for colon cancer. It's probably a little overrated. You still have to do a bowel prep, and it can miss some colon cancers. Although you don't have to go to the hospital and have the colonoscope run through your colon, and some people prefer that. The other test is either a flexible sigmoidoscopy, which is a short scope that's introduced into the rectum. It looks at the first section of the colon, where historically we thought most of the colon cancers were on the left side in the first, say, 30 centimeters of the colon. That's probably not true anymore. It turns out we got a lot of right-sided colon cancers too. So sigmoidoscopy's kind of fallen out as a great colon cancer screening test, although it's still reasonable to do something rather than nothing. Colonoscopy's a gold standard, and it's a piece of work, right? You got to take some prep. You got to take these cathartics, drugs, the liquid that makes you move your bowels, and you clean your bowels out completely. And then they can introduce this scope through your colon and look at the whole thing. If they find a suspicious area, they can biopsy it. And there are certain polyps that are cancerous or precancerous. Many times they can take those out right there during the colonoscopy and basically treat your very early stage colon cancer without anything else. So if you choose to have colon cancer screening, which we think is a reasonable idea, one alternative is this annual stool test for blood. You can ask your provider about that. We can give you the cards. There are, beyond that, other levels of colon cancer screening, and you just have to talk to us. We'll talk to you about what's the risk, what's the advantage and disadvantage, and we'll come up with a plan. Just so you know, typically we do the fecal occult blood screening, or the testing of your stool, once a year. Colonoscopy, if you have a normal colonoscopy, it's every 10 years. If you have a colonoscopy where we find a bunch of these little precancerous polyps, you're going to get a colonoscopy more frequently. We're going to go in there and mow those off every 2 or 3 years to make sure that you don't develop a colon cancer out of one of those precancerous polyps. If you find colon cancer late, it's really a catastrophe. People have about a 5-year life expectancy with late-stage colon cancer, but it's a very, very long, awful 5 years. So we would hope that you would get some screening done, look for colon cancer, look for changes that indicate early colon cancer, and if you have it, we can fix it relatively easily without having to go through years of misery and really a horrific end-of-life struggle. So, not the best topic. Hope you talk to your provider about it. And if you have questions, make sure you hand them off to us and we'll share our best advice with you. So thank you for using Sunrise Medical Group. We hope you have a great day.